Hello, Liam, or anyone else watching this. So you want to become a PA, but you don't want to learn all of the word components. Not a good idea. You see, going into the hospital or any medical setting without a firm grasp of medical terminology is like finding your way through a maze while blindfolded. Better yet, it's like constructing a building without using a blueprint. Sure, you can get a general idea of what a building is just by looking at it, but why or how its components create the final product is a different story. By a stretch, medical terminology functions in the same way. Terms are created by components which work together to create a final product with meaning. Allow me to go in depth. There are four types of word parts: a word root, a combining form, a suffix, and a prefix. Word roots are the fundamental and basic meaning of the term. It usually, but not always, indicates the involved body part. For instance, therm means heat, gaster means stomach, and cardi means heart. These are typically attached to the next type of word part, a combining form. Combining forms are word roots with a combining vowel at the end, typically indicated by a backslash in medical textbooks. Examples would be thermo, gastro, and cardio. Next up, there's the suffix, which usually, but not always, means the procedure or condition. They always come at the end of the word with a hyphen behind it. For instance, IA, pronounced ia, means abnormal condition, itis means inflammation, and penia means deficiency. Lastly, or firstly I suppose, are prefixes. They come at the beginning of the word and they typically, but not always, indicate location, time, number, or status, and they have a hyphen at the end. For example, hyper means excessive, hypo means deficient, and anti means against. Combining these word parts together crafts a word. In order to do this, there are three general rules. 1. Word roots must have a suffix to complete a term. Arthur, meaning joint, by itself is not a term, but adding the suffix itis makes it arthritis, inflammation of the joints. 2. Combining forms are used when there is a consonant following it. For instance, using neuro and the suffix plasty. Since plasty starts with the consonant P, we would use the combining form to make neuroplasty. However, if we use the suffix itis, which starts with a vowel, we would omit the combining form and just use ner, making neuritis. If there are two root words, like in the case of gastroenteritis, the first root word must always have a combining form. 3. Prefixes are always used before the term. For instance, postnatal, meaning the time and events after birth, has the prefix post at the beginning. But what happens if we see a new word and we do not know what it means? Since we know that terms are comprised of components, we can take them apart. To do this, there are some general guidelines that we need to follow. For starters, we start with the end of the word, otherwise known as a suffix, and then make our way towards the beginning. We need to figure out the meaning of every component. Because some word parts have multiple definitions, we need to find the context of the body system that the term is referring to. Let's take apart some examples, starting with otorhinolaryngology. We start by splitting up the word. The suffix ology is the study of. The root larynx means larynx, or throat. Rhino means nose, and oto means ear. Larynx does not use a combining form because ology starts with a vowel. Together, otorhinolaryngology means the study of the ears, nose, and throat. Let's also look at poliomyelitis. Breaking the word apart gives us itis, inflammation, myel, spinal cord, and polio, gray. Putting it together gives us the definition: inflammation or infection of the gray nerve tissue in the spinal cord. Lastly, let's look at hepatomegaly. The procedure is standard. Break up the word and then define the individual parts. The suffix megaly means enlargement, and the root hepato means liver. Therefore, hepatomegaly means abnormal enlargement of the liver. Got the hang of it? If you know the different components in medical terminology, it will make understanding medical terms a whole lot easier. But not everything is smooth sailing in the medical terminology world. Some terms seem similar, but they have completely different meanings. For instance, take the prefixes ab and ad, or inter and intra. Ab means away from, while ad means toward. Inter means between or among, while intra means within or inside. Confusing terms are not exclusive to prefixes. Take the root words cyto and cysto. Cyto means cell, while cysto means bladder. It doesn't stop there. Take a look at these three suffixes: gram, graph, and graphy. Gram is a picture or record. This includes an angiogram, meaning a picture of blood vessels. Graph also means picture or record, but it also refers to a machine for producing a record. An example is an electrocardiograph. which is the machine that records the heart's electrical activity. Graphy is also similar, but it means the process of recording. So, in accordance to the previous example, an electrocardiography is the process of recording the heart's electrical activity. The suffixes scope and scopy follow a similar pattern as well. Scope means an actual instrument that is used for visual examination. This includes an endoscope, which is an instrument used to visually examine internal structures. Whereas on the other hand, scopy means a visual examination, so an endoscopy is the visual examination of internal structures. There are other ones too, such as tomy, ectomy, and stomy. Tomy refers to the process of cutting. An example includes craniotomy, the surgical incision or process of opening into the skull. Ectomy, on the other hand, means a surgical removal. An example includes ostectomy, which is a surgical removal of bone. Lastly, there's stomy. It means creating an artificial opening to the body surface. An example of this includes a colostomy, the surgical creation of an artificial excretory opening between the colon and the body surface. All in all, getting into medical terminology can be somewhat daunting upon first glance. However, it is absolutely vital in the medical field, and it will make your experience more efficient.